Hi everyone. So I hope you enjoyed watching the film Sick Around America. I know it's kind of a hard film to watch in terms of it being kind of dark and showing some really negative effects of not having access to the healthcare system. However, I thought it was a very important film to watch prior to learning a little bit more about what led to the development of the Patient Protection and Affordable Care Act. So, in this film, which I hope you found interesting, there were some major takeaway points that I want you to remember and that were asked of you for the homework classwork assignment. So, some of the major points from this video include that healthcare access really does affect not just your physical well being, but also your social, spiritual, emotional well being. Um, it has a real impact on your social life. And your homework assignment, your classwork assignment asked you a couple of different examples about how your social life could be impacted by not having healthcare insurance. So let's think about a couple of those ways. In the video, we saw a student who, or not a student, but a person young in their career who was afraid of changing careers because the current job he had helped provide health insurance, right? He worked for a larger company, and because of working for that larger company, health insurance was provided. So, but he still couldn't really do what he wanted to do because he couldn't get health insurance if he changed jobs. Um, Other examples of how health access and health having access to health insurance could affect your life was also illustrated by the couple who couldn't get a divorce, who stayed in a relationship after it expired, even though they'd prefer to no longer be married because the couple were on each other's health insurance plan. So getting that divorce was just not an option. And last but not least, there's also another example of um, one of the people in the video moving back in with his mom, right? Because of medical bills that were just mounting. He couldn't afford to pay them and pay rent. And so his even like autonomy to live on his own was compromised because he had to be able to pay for health insurance. So in various ways, the whole purpose of this first part of the lecture is to show that we have a broken healthcare system. And unfortunately, the Patient Protection and Affordable Care Act didn't suddenly heal all of our woes. However, it was a first major attempt to change something about the way we deliver healthcare to make it more affordable for all and to try to reduce the number of people who are uninsured. The film also talked about another very important concept of medical underwriting as well as rescission. So, medical underwriting was the term that's used to when healthcare insurance companies, there were individuals that are hired in health insurance companies that their very job is to see where there are discrepancies between a medical history and what patients have reported. Healthcare insurance is a business. It's a business that's made to make money. And when do health insurance companies make the most money? When you're paying for health insurance, but you don't actually have to use it, right? So you're paying your monthly premiums each month, right? They're collecting a certain amount of money from you for your premium, and they lose money when they actually have to pay for a health procedure or medication for their clients. So again, if they're collecting money, they're gaining, but if they have to pay out, they're losing. So as a financially based organization, just like every other type of business, um, if they can find a way to not necessarily have those expenditures, they can save money. So by hiring people who'd go back through and compare, this is what they told me, was this a pre-existing condition or not, they could do something called medical underwriting saying, hey, this person did not report this health concern. So in essence, they were lying to us, or failed to provide this information, and we wouldn't have insured them had we known about this particular case or incident or pre-existing condition. And so we can rescind or remove our healthcare insurance for this person, even though they've been paying in for a while, because they failed to provide us this information. So this was more often on private healthcare plans. So when your company provides your healthcare insurance, or through your company you're paying for health insurance, and not through Medicaid or Medicare or CHIP, right? Those government funded healthcare plans. But if you were paying for private health insurance, paying out of your pocket for private insurance, that more often you found that this was going on. That at the time that you needed your healthcare insurance for a procedure, that someone working within the health insurance company could, via medical underwriting, see that you hadn't claimed a health concern, a previous health concern, even something like a headache, or something you'd been treated for years prior that no longer had an impact on your health. Because you weren't claiming it, they weren't considering that when they were considering you for covering you via their health insurance plan. So they could rescind, they could remove, they could retract your healthcare coverage at a time when you needed it. So because of these pre-existing conditions and medical rescission, and because not everyone had healthcare access, who even those who wanted to be covered, some individuals just thought, hey, I don't need healthcare coverage, but other people wanted it and couldn't afford it. Because of this lack of healthcare coverage, because of our increasing cost for healthcare, because of medical underwriting, because of rescission, and because of denying access to coverage because of pre-existing conditions, we found the need to change our healthcare system. So again, with having watched this film, I just want you to remember and recall this information when moving forward with our discussion today. That's all I have for now.